Good Sunday afternoon, folks. I have A for you this afternoon. We're talking about elderly balance and bone health. Okay, so give me a few minutes to set up for the show and then we'll get going. Okay. All right, balance and bone health is today's topic for A. Okay. Balance, what it means and why it matters. Balance is the body's ability to distribute weight so that you can stand, move, and recover from trips without falling. It depends on coordinated input from the vestibular system, inner ear, vision, perception, sensory nerves, and muscles and joints, and muscle strength and joint function. Declining balance is common with age and is a major cause of falls, fractures, and traumatic brain injuries in older adults. Common causes of balance problems: inner ear, vestibular changes, damage or age-related loss of vestibular nerve cells can cause dizziness and vertigo. Vision problems, reduced ability to judge distance and depth, increases instability, reduced perception and muscle function, weaker, stiffer, or slower muscles, and less sensitive foot nerves make quick connective movements harder. Medications and alcohol. Many drugs, antidepressants, antihistamines, blood pressure meds, sedatives, painkillers can cause dizziness or slow reflexes. Taking multiple drugs raises the risk. Acute illness, infections, or dehydration can temporarily disrupt balance. When to contact a clinician. Any new or worsening dizziness, lightheadedness, or vertigo. Any fall or increase in near falls. If balance problems limit daily activities or cause fear of falling, okay, here's where you get an earlier evaluation, guys, to see if you have an issue with this or not. Okay, so we're going to go through this section now. Early evaluation helps prevent serious consequences and breaks the cycle where fear and inactivity worsen balance. How balance problems are evaluated. A clinician will typically check blood pressure, lying and standing, observe gait, and test foot sensation. Review current medications for side effects or interactions. Refer for specialist testing. ENT, audiology, if any ear causes are suspected. How to improve balance. Address reversible reversible causes. Review and adjust medications. Treat dehydration and correct vision problems. Exercise interventions. Tai Chi, yoga, Pilates, strength training, walking, stair climbing, and targeted balance exercises all help. Some balance exercises can be done seated. Okay. Professional guidance. A physical therapist or trained instructor can tailor exercises to ability and fall risk. Regular strength training or regular strength and core work reduces the chance of entering the decline in fear cycle. Practical tips for reduce fall risk now. Get medication review with your doctor or pharmacist. Schedule eye exam and update corrective lenses if needed. Stay hydrated and treat acute illness promptly. Start gentle, balance, and strength activities. Tai Chi supervised classes are especially effective. Report any fall to your clinician, even if there's no injury. And then we'll go into strength training builds more than muscles. Core idea. Strength training does more than increase muscle size and force. It also protects and builds bone, improve balance and power and lowers fracture risk, especially as we age. Why this matters for older adults. Bone health, resistance exercises, place mechanical stress on the bone, which stimulates bone forming cells that help slow age related bone loss and can even increase bone density, reducing the chance of fracture. Fracture prevention. Hip, spine, and wrist fractures most the most common and most serious. Osteoporotic breaks, stronger muscles and bones plus better balance reduce both the likelihood of falling and the severity of the injury if a fall occurs. How strength how strength training helps beyond bones, improves stability and confidence. Exercises that emphasize power and balance make it easier to recover from trips. And encourage continued activity which in turn preserves independence. Target targets high risk sites. Resistance work tends to load the hips, spine, and wrist, the exact areas most vulnerable to osteoporotic fractures. Practical takeaways. Tips of resistance, types of resistance. Free weights, weight machines, and resistance bands all work. Include movement or include moves that build strength, power, and balance. Consistency matters. Regular progressive loading is what nudges bone forming cells into action and preserves muscle and function over time. Safety. Start at an appropriate level, progress gradually, and get professional guidance if you have health concerns or osteoporosis. Bottom line, strength training is a high value, evidence based strategy for healthy aging. It builds muscle, strengthens bones, and reduces fall risks, and helps maintain independence. For for more detailed programs and tips, the article points to Harvard Special Health Report on strength and power training. harvardhealth.edu. Summary. Everyday habits can quietly erode bone strength over time, raising the risk of osteoporosis and fractures. The Harvard Health piece explains that common diet and lifestyle choices may, many of them routine or culturally normalized, act as risk factors that accumulate and weaken bones if not addressed. Why these habits matter. Bones are living tissue that respond to mechanical load, hormones, and nutrition. When habits when habits reduce the mechanical stimulus, less activity, alter hormones or nutrient supply, poor diet, low body weight, or introduce toxins, smoking, excess alcohol, bone breakdown, outspaces formation, and density falls over years. This increases fracture risk and loss of independence. Common everyday habits that weaken bones: low dietary calcium and vitamin D. Not getting enough of these building blocks limits bone maintenance. Sedentary lifestyle, little weight bearing, or resistance exercises reduce stimulus. Uh, bone, bones need to stay strong. Smoking tobacco harms bone cells and interferes with hormone balance. Excessive alcohol, regular heavy drinking impairs bone formation and increases fall risk. Crash dieting or very low body weights, too little body mass, and poor nutrition remove protective loading and nutrients for bone health. High salt and some dietary patterns. Diets that increase calcium loss or lack of key nutrients can be harmful over time. Certain medications and medical conditions, long-term use of steroids, some anticonvulsants, and untreated hormonal disorders can weaken bone. How to protect and rebuild bone strength. Eat for bone health. Ensure adequate calcium and vitamin D through food and supplements if needed. Do regular strength and weight bearing exercises. Resistance training, brisk walking, stair climbing, and balance work all help preserve bone and reduce falls. Quit smoking, limit alcohol. Stop stopping stopping tobacco and cutting back on alcohol improve bone recovery and overall health. Review medications and health conditions. Ask your clinician whether any drugs or untreated conditions may be harming bone and what alternatives or monitoring are appropriate. Okay, last page, guys. Practical steps. Practical next steps. Get a bone health check. If you have risk factors or are over 50, ask your clinician for a medication review and nutrition plan. Start a safe progressive strength program and add balance exercises to lower fracture risk. If you want, I can turn this into a one-page checklist for a clinic visit or a short beginner strength routine tailored to your mobility level. Okay, guys, that is A for today. I will be back on tonight for B and C later, about 9 o'clock. I'll jump back on and do 2 more shows. For now, Gator Wellness. Take care, folks.